taping technique is for Achilles tendinopathy or any kind of inflammation, the posterior aspect of the heel. You could probably even use this technique for retrocalcaneal bursitis, and it's a really nice technique to help to accelerate or help your rehabilitation along, and certainly very comfortable and gives the patient quite a lot of relief. We're going to use some Hypafix, which is hypoallergenic tape. This is the 5 centimeter, and I'm first going to establish an anchor roughly around the musculotendinous junction of the gastrocs. So I'm just going to peel off the Hypafix. And I'm just going to let it follow the actual shape of the calf. And we're also just going to put a little anchor around the foot. Just helps again for the taping to stick to. The tape we're going to be using for the actual strips is the rigid tape. I like to use the Leukotape. This is a 38mm tape, and we're just going to measure the bits that we need. So just use the back of it, the non-adhesive side. We want to start roughly from halfway where the Hypafix is here, and we're going to just measure it to where we need to be there. And you're going to measure 3 identical strips. And we're going to start in the middle, and you do want to make sure that the patient's foot is actually in the middle. Some people have a tendency to have a bit of medial deviation. You can correct that once you actually position the tape. So we want to make sure we're in the middle. Okay, and then we're going to make a small incision into the tape there, and we're actually going to rip it. Once you've made the little snip, you're going to rip the tape literally till just above the actual insert of the Achilles tendon onto the calcaneus. Okay. And if you've ripped too far, like I've done there, it's not a problem. We just keep that piece for later, and we just do another piece. And when you're ripping, always try and keep the one piece straight and still and lift the other one up. That's usually the easiest way. Distorts the tape the least. So once we've got that, usually in this position, the foot is in the perfect position that we need it to be. Rather than lying, for example, completely flat, which puts the foot in too much plantar flexion. So this usually creates the right amount of tension. I will need to correct his heels slightly there. I'm going to stick this around here, so basically we're going to create a little weave at the base of his foot, and we've got the end bits again to stick to that anchor that we created earlier on. The next strip, we're going to overlap a half at the top end, but we straight away move it to the middle again. We're going to make another snip, and this time we're going to rip it till just above the first cut that we created there. Okay, we're overlapping by half. If the creases up a little bit, try and make sure you get the creases out. overlapping by half. Again, you're creating a little basket weave over there, which always strengthens the positioning of the tape. Now we still had our first bit left from earlier on, which we're now going to position on the medial side of the second strip that we've put down. And then we stick that down, remember again to overlap by half. The nice thing about this technique is that it actually leaves the heel clear, which is obviously much better for any shoe wear. And then what we need to do is basically fix the actual strips in place so they don't come off. And again, I like to use the Hypafix for that. So that keeps those in place. One more strip to keep these ones in place. Just to go with the flow of the foot. Okay, make sure that that's all sticking nicely. And then you can ask the patient just to have a little walk, make sure that there's no tension points anywhere, and that it's actually having the desired effect. And the patient will often experience this taping as giving them a slight little push off as they, after heel strike, as they follow through. They'll feel that they just get that little push off on the actual toe off position. That's it.